explain what the purpose of the clinic was, and it was just a lot of people who got together and just saw that there was a need in Fayette County, and that we just wanted to kind of pitch in to help.
My name is Dr. Janet Gerard with the Peachtree City Physician Group, and I really enjoy volunteering here. I choose to do this after working a full day at work because I'd like to give back to the community.
So I've come here, it's been a year now, and they've taken care of me, and I'm looking for work. They're always cheering for me.
When Katrina hit in New Orleans, we evacuated here. Wilbert and I, as well as our youngest daughter, who was still living in New Orleans at the time with our oldest grandson.
Hi, my name is Wendy Peterson. I'm a physician assistant at Family Medicine Specialist, and I'm a practitioner and president of the Fayette Care Clinic.
My name is Jean Judd. I am a volunteer at the Fayette Care Clinic, but I first started as a patient because I didn't have insurance.
Hello, I'm Cheryl Watford, Executive Director of Fayette Care Clinic. What I want to talk to you about tonight is what we've accomplished in the last year. In the last year, we have added services with Piedmont Fayette Hospital. We have added a partnership between us and Outpatient Imaging to provide radiology. We have added Georgia Lions Lighthouse for vision care, and we have added 4 diabetic classes in the past year. We plan to have more classes in the upcoming year. Our goal is to add 40-hour weeks in order to see the patients who need our care. Right now, with the economy on a downturn too, we have seen and noticed a huge increase in new patients. What we need is your help. What we're asking for is a community to take care of itself. What we'd like for you to do is call us and volunteer. We need all types of volunteers. We need volunteers on the desk. We need nurses. We need dentists. We need physicians. We need physician's assistants, nurse practitioners. And we also need people just to greet our patients when they come in the door. So as we continue, do we need funding? Yes, we do. But we also need more volunteers. So I'm asking you to come together with us, work with us, to take care of our community. Thank you.
I know that there are a lot of people who require our services, and we can provide a lot for them, and it's just wonderful to finish up with a patient and see them smile and say, thank you so much for volunteering your time, Dr. Gerard. So I invite you to join us and share some time with us and become a volunteer at the Fayette Clinic.
In 2006, I moved to Georgia from Texas. My father had died, and I had no more family, and my brother lives here, and so I thought I would come here and work. And work was hard to find, and then I ran into a medical problem. I had a heart attack, and the doctors determined that I also had diabetes. So they did the emergency first work and then set up they outlined the program, but I couldn't meet that. There was no way. And a nurse that gives her time here at Fayette Care Clinic had told me that I should come here and talk with the head and see about getting qualified for help. And so I had to do that, and I came over here and I met Cheryl, and I did the paperwork and talked, and they looked at me and gave me an examination, they obtained the medical records, looked those over, and I was accepted in, and then they began to take care of me medically and provide medicines for me. And they started a new program for diabetic patients, teaching us what is it that's happened to us, how to take care of ourselves, what to look for. And all of us were just, we were always oohing and aahing about stuff. We had ideas of what it meant to be diabetic, and it turned out that some of that was not accurate. But how to take care of ourselves, how to eat properly, which of course diets tell you that, but we had to watch for blood sugar concerns, how to test our blood sugars, what specific things to do that helped us control the blood sugar and to keep it in mind. And through those lessons, for the time that we had them, we learned about medical care, taking care of our feet, products that actually do help. And then the exercising, of course, they helped me to focus mentally. I needed that kind of help too, and I've lost and kept off over 50 pounds and have watched my blood sugar. I've changed my diet, and so they've helped me to do really much better. I'm in better shape today than I was when I came here, physically, notwithstanding that very likely they've saved my life.
And then I went from being a patient without insurance to getting insurance. But I continue to volunteer. I've been volunteering for over 2 years. I met wonderful people here, wonderful providers. The first person that I truly remember was Cheryl and Wendy. Wendy was my first provider. She gave me really good medical care. I continued to come as a patient for about a year or more. And then I have, received insurance. And I continue to come on Thursdays. Once a week I come to help with their clerical, is providing the charts, to get the charts set up for our patients, their input to see if they qualify.
So you go get a blood test?
Yes, send you for blood tests, but they also would find ways for you to find free medicine.
Free medicine?
Not only would they try to supply you with whatever they had in the office, they would go out of their way to find other organizations that could help you in your time of need. And that's special. That's very special.
Fayette Care Clinic is part of the Georgia Free Clinic Network, and we're the only clinic that offers 3 services of vision, medical, and dental. What I love about this clinic is we're taking care of our own in Fayette County. Before our doors were opened, our patients that were uninsured were seen in the emergency room. And that's a great place. However, what we do differently is we provide continuity of care for their chronic illnesses like hypertension and diabetes.
All we can say is thank you to the people here at Fayette Care Clinic.
God bless them all.
We hope and I trust that other people are being helped as much as we were helped, and I do believe they are.
One thing I've learned about the patients that I see here is they're not really any different than you and me. But due to life circumstances, sometimes a wrong turn in the road or a turn in the road that they had no control over, is they're now being seen and they're uninsured. They don't qualify for Medicaid, they don't qualify for Medicare, and if they're employed, their employer doesn't offer health benefits, or the cost is so prohibitive for them, they can't afford the health benefit.